you today, Olga?
Well, the doctor said that something's wrong with my kidneys because of my diabetes.
Okay. Well, my name is Lee. I'm going to be the nurse going over your disease process with you today and kind of do some teaching on what you're going to need to do for it. I noticed that you didn't bring your husband or any family members with you, and I know that they're an important part of your decision-making team. Do we need to schedule for a different time to meet so they can be here to support you?
No, it's okay. They're working. They'll just come later if they need to.
Okay.
Or I'll tell them.
And you can always feel free to call if you have any questions, or if they have any questions, and then we can pick a different time to meet. Your doctor has diagnosed you with renal insufficiency. You've had type 2 diabetes for 10 years now due to poorly controlled blood sugar levels. Over time, if your blood sugar runs high, it causes damage to your blood vessels. This damage to the blood vessels can then decrease blood flow to your organs, including to your kidneys. When this happens, then your kidneys become damaged and you get renal insufficiency, or they sometimes call it diabetic nephropathy. This is very common in diabetic patients, and the extent of damage is based on how high your blood sugars have ran over the last several years. Your renal insufficiency means that your kidneys have decreased function and they will not be able to remove all the waste from your bloodstream. You may experience high blood pressure, low blood count, and an imbalance of sodium and chemicals in your body. Typically, the doctor can tell that you have damage to your kidneys by increased protein in your urine, a reduced glomerular filtration rate, and an increased blood pressure, which is why he had you do the blood work today and brought your urine in for testing.
So what kind of treatments can you do? Do you get a shot? Do I drink water to flush them out?
Well, the doctor, very good questions, but the doctor is going to actually start you on a treatment regimen, and I'm going to go over that with you. He's going to put you on certain medications, diet restrictions, and a healthier lifestyle in order to prevent further damage to your kidneys. If damage to your kidneys worsen, then your kidney function may not be able to support the body functions, and extensive treatment may then be required. So it's very important that you follow these recommended treatment regimens so that you decrease the risk of having further kidney damage. I see that you're taking metformin for your diabetes.
I have been for a few years now.
Okay. Well, the doctor is going to want to stop that because metformin can actually cause a buildup of acid in your blood and tissues, which can cause death if you have renal insufficiency because your body is not eliminating the medication as it should. So the doctor is going to start you on glipizide. Glipizide is a tablet that you will take 30 minutes before meals. And it's important to take the medication as prescribed, and you do not want to take more or less than what the doctor wants you to take without talking to him first. Also, if you miss a dose of the medication, you're just going to want to take the dose that you have coming up. Don't double take, okay? The medication may be adjusted depending on your lab test, which we'll perform when you come here for regular checkups. And you'll need to make sure you let us know if you have, if you start any other medications or any other doctors put you on any other medications, including over-the-counter medications. Side effects of the glipizide may include diarrhea, gas, feeling jittery, dizziness, uncontrollable shaking, red or itchy skin, rash, hives, or blisters. And serious side effects can include yellowing of the skin and eyes, light-colored stools, dark urine, pain in your stomach, unusual bleeding or bruising, fever or sore throat. And you'll need to make sure you notify us if these side effects occur, okay? Also, it may cause sensitivity to light, so you may want to wear protective clothing or sunglasses when you're out in the sun. And you're not allowed to use alcohol with glipizide because it can worsen the side effects. Do you have any questions about this medication?
No, ma'am.
Another medication the doctor is going to want you to start taking is lisinopril, and this medication is used in diabetic and renal patients because it can slow the progression of kidney disease, and it also can reduce the amount of protein that you're putting out in your urine. The medication also treats your high blood pressure, so when you get kidney disease, your blood pressure can go up, so this will also help with that. The medication may cause dizziness, lightheadedness, tiredness, or headache in the beginning while your body adjusts to it. And you may experience a dry cough, which is a very common symptom for most patients. You need to make sure that you tell your doctor if these side effects continue or if they get worse. Serious side effects may occur, such as fainting or signs of increased potassium, which are muscle weakness or slow irregular heart rate, and you need to report these to us immediately. Also, if you experience yellowing of your skin, eyes, dark urine, stomach pain, continued nausea or vomiting, you need to make sure that you let us know immediately. Do you have any questions about this medication? Okay, the next medication that he's going to want to start you on is called Lasix.
Okay.
And another pill. This will be the last of the regimen. This medication will help to eliminate sodium and potassium along with excess fluid from the body, and you'll want to make sure that you don't get dehydrated or your potassium doesn't get too low while taking this medication. So you'll need to monitor for dizziness, low blood pressure, so monitoring for blood pressure daily is very important. And if you have a dry mouth or dry mucous membranes or weakness, those can be signs of dehydration, and then muscle cramping can be a sign of low potassium.
So if I get all that, do I need to go to the emergency room?
If you just have signs of dehydration, you have a low blood pressure, or you have dry mouth, dry mucous membranes, you're feeling weak, then you can just drink a little bit more fluid. And you can also eat foods with salt in them, a little bit higher sodium, and that will bring your blood pressure up and help your dehydration. If you get muscle cramping, you'll need to call and let us know, and we'll need to do a blood test to check your potassium, and if it's low, then we can start you on a pill for that. It's very important that you take these medications as the doctor has ordered. This will keep you as healthy as possible and slow the progression of the disease. It is important to let us know if you receive treatment from anyone else or if you receive treatment with herbal remedies. To go along with your treatment regimen, there are further instructions that your doctor would like you to follow. So you're going to want to monitor your blood sugars closely and monitor your blood pressure at least daily. Take all medications as ordered and let us know if any other doctor has started you on any medications or if you're taking any over-the-counter medications. You'll also need to let the doctor know if you have any tests performed, especially if you have anything done with IV contrast dye, because taking that can substantially damage your kidneys and cause you actually go into renal failure. So make sure that all your other doctors know that you have renal insufficiency, okay? Also, you'll need to stop smoking, and you'll need to start exercising regularly. Dietary changes will need to be made, such as decreasing sodium and protein in your diet, and you'll need to keep your lipid and cholesterol levels controlled to prevent further progression of your disease and decrease your chances of heart disease. What kind of foods does your diet consist of now?
Let's see, last night I ate quesadillas and beans. Today for lunch I had a pork chop and some fruit.
Okay, well you'll need to decrease the intake of proteins in your diet. So those are things like your meats, your cheeses, your beans, eggs, if you eat a lot of eggs, because these can cause further damage to your kidneys, because protein is big, and when it passes through your kidneys, then it can cause damage to the function that you have left. As your disease progresses, you may have to limit foods high in phosphorus and potassium, but we'll perform blood work frequently to monitor these things, and if that's the case, then the dietitian can talk to you more about that at that time. The doctor is going to refer you to a diabetic educator so we can make sure that your blood sugars are under control, and a renal dietitian, and this way that you have support to control your blood sugars and a renal diet plan. And the dietitian can also give you tips on how to cook for your whole family and still adhere to your diet plan instead of just having to cook a meal for you and then maybe a meal for them, because I know that makes it kind of hard when you're cooking for several different people. It's also important that you keep your checkups here with the doctor, because we'll be doing the blood work and the urine testing frequently to monitor your kidney disease. But it's very important that you notify us if any of these symptoms occur: excessive edema of the legs, arms, and face, shortness of breath, muscle weakness with severe fatigue, tiredness or fatigue that persists, continued high blood pressure, itching, decreasing urination, muscle cramps, nausea, vomiting, not feeling hungry, trouble sleeping, or diarrhea, because these can be symptoms of worsening kidney function. So if you have any of those symptoms, you'll want to let us know and not wait until your next appointment, okay?
Okay.
I'm going to give you a few handouts over the disease process we discussed today so that you can review them with your family. And just let me know if you or your family have any further questions. Do you have any questions for me right now?
Not right now.
Okay, well just let me know if you need anything else, okay, Olga?
Okay, thank you.